I'm Dr. Stephen Kato. I'm pediatrician. I enjoy what I'm doing, and this is why I'm still doing it. When I look back on it, first of all, I wasn't even sure I wanted to become a doctor. When I went to UCLA, that's what I did my undergraduate. And the great thing is that there were about 8 of us that got very close together there. All 7 of them knew exactly what they wanted to do, and 3 wanted to become doctors. And so I got interested and said, this sounds like a very good idea. So I went to University of Cincinnati Medical School. Actually stayed there at Cincinnati Children's Hospital for my residency because it's a really great children's hospital. And that's why I think I became a pediatrician. It came down to whether I wanted to do internal medicine or wanted to do pediatrics, which is on the opposite spectrum as far as age is concerned. And I just decided, I just love seeing healthy children and dealing with families. I still enjoy taking care and seeing little babies, children, teenagers. I just enjoy it. I was doing a physical on a teenager, and the first thing I noticed when I looked over the chart or the computer before I went in, I said, boy, he's lost a lot of weight. He used to be very overweight. And so I went in, I complimented him. I said, man, you really must be watching what you're eating. And the mother said, Dr. Kato, a year ago when we came into his physical, you mentioned the fact he is overweight, you need to diet, and you actually spent some time on how to diet and how to eat. And he says, you really impressed him. He decided that's what he would do. And he said, I made a difference. To be honest, my life really revolves around medicine itself. I spend a lot of hours. I'm known as a very hard worker. I never thought of myself as the most brilliant physician around, but I knew that if I just worked hard at it, that I would do well. But I love doing fishing, ocean fishing, like most Japanese Americans. We love fishing. The most recent thing, I think, is I've actually started to collect a lot of used books, usually from libraries. I found that libraries are a great source of used books. They have used book sales. They have used books stores, some of them. I think I visited about 75 libraries in the area. Like all physicians, I try to do the best I can for the patient, but it also means that you need to enjoy it. Otherwise, you'll never last doing it. I love being a physician. I just love being a pediatrician, and I would never change anything.